think it's recording. Yep. Okay. Good morning or good afternoon, everyone. My name is Katie Bisaha. I'm a program officer at the New Jersey Healthcare Quality Institute. Um, and today we will be hearing from Jenna Sistad, who is the Executive Director of the Neighborhood Connections to Health, and Annette Jordan, who is a Freehold Borough Councilwoman, on how to build more inclusive, community-driven health and wellness programs. So I do encourage you all to have your camera on, as there will be some interactive components to the presentation. And honestly, sometimes just listening to us talk isn't going to be as interesting in it as if you're participating. Before we get started, I just want to introduce the Quality Institute, though, and the Mayor's Wellness Campaign for those who may be unfamiliar. Okay. So the New Jersey Healthcare Quality Institute is an independent nonprofit organization dedicated to improving the safety, quality, and affordability of healthcare. So since 1997, we have led statewide efforts to transform healthcare by bringing together our diverse members, including health systems, insurers, providers, consumer groups, and employers, to find solutions grounded in evidence and collaboration. And ultimately, our mission is to improve the healthcare for everyone in New Jersey. And just a little detail about the Mayor's Wellness Campaign. There's over 400 participating communities. It's always mind-boggling to know that there's that many communities in our tiny state. We really just give mayors and community leaders like yourself evidence-based tools and guidance to improve the health and wellness of your community to help your residents live their healthiest lives. Okay. And today's presentation is going to just focus on how you can listen to your residents and build programs that meet their needs, support volunteers and local leadership, building trust and strong partnerships in your community, and then creating programs that really fit your community. And both Jenna and Annette have done a really great job, and they're going to explain more about how they've been doing that. But first, I just want to intro our speakers. So Jenna Sistad is the Executive Director of Neighborhood Connections to Health, a greater freehold-based community coalition, and project manager for the Ocean Monmouth Health Alliance, a regional chronic disease prevention coalition. Her journey supporting underserved populations through public health efforts began in 2009, where she started working with individuals with disabilities, and she was providing respite programs and seizure first aid training in all 21 counties in New Jersey. So after 8 years, she then transitioned to a role in early childhood development, overseeing a parent advocacy coalition. And since then, she has gained a variety of experience creating and administering all types of inclusive initiatives in New Jersey, such as day and overnight camps, health education, advocacy councils, food access programs, and public health platforms. Her niche is creating local grassroots efforts using a shared leadership model, where she believes that you must include leaders in the community in change to make efforts that you want to create sustainable change. She also brings a personal perspective to her work as a caregiver for her father, a stroke survivor who needed total care. And she resides at the Jersey Shore with her husband and 2 young sons. And then we are also going to be hearing from Annette Jordan. She was the first woman elected to the Freehold Borough Council in 2019, or was first elected in 2019. Sorry about that. As a council member, Annette is the former council president, member of the Finance Committee, and chairperson of the Redevelopment Committee. In addition to those committees, Annette also serves as the liaison to the Freehold Borough Recreation, Board of Health, Participatory Budgeting, and Mayor's Wellness Committee. Outside of her council responsibilities, she serves as the president of the board of Neighborhood Connection to Health, the Alliance to Prevent Substance Abuse, Spooktacular, and Old Freehold Day committees. She's passionate about providing health, safe environments for residents of the Freehold Borough area to flourish and raise their family. And with that, I'm going to pass it over to Jenna and Annette for their presentation. And thank you again.
Thank you, everybody. And hello, good afternoon. I'm going to start to share my screen. And the initial part of our presentation is interactive. So if even for the first 5 minutes, you can take yourself and put yourself on camera so that we can interact with you. And Annette, I don't know if you wanted to say anything as the welcome and intro while I'm getting my screen set up.
Sure. I just want to say, first of all, thank you to Katie and the Mayor's Wellness for having us today. This is something that Jenna and her team, as well as I, are passionate to talk about, the health and well-being of the people that we serve here in Freelborough. So I'm excited for your questions, and I can't wait to talk a little bit more about what we do.
Thanks, Annette. Yes, and thank you, Katie and team and everybody at the New Jersey Healthcare Quality Institute, as well as the Mayor's Wellness Campaign, because you all support all of the things that we do. And so we're very grateful for this opportunity. Can everybody hear me okay before we go ahead and get started? All right, I see the thumbs up, Katie. Thank you. So from programming for the community to programming with the community, right? Effective strategies to, and here are just some examples of the things that we'll talk about today. Get more people involved in the things that you're doing, your programs, your organization, community work. Include residents in the planning and decision-making. So how can we use that shared leadership concept in creating and running programs that will have long-term lasting impacts, right? And how to create volunteer networks and support them throughout the work that you're doing together. And being intentional about building partnerships that last, as well as partnerships that are fruitful and have like-minded missions. Before we get into all of that, I would like to do a little activity with all of you, right? So here's our icebreaker. You've all heard of this put a finger down if group, right? You've seen TikToks or videos. I'm not myself on personal social media, so I don't see this a lot, but just as a quick explanation, if you all could participate and play put a finger down if with me. So for those who don't know it, you put your hand up like this next to your face, all 5 fingers to the air, and I'll make a statement such as, put a finger down if you have a son. And for me, I would put my finger down because I have a son, right? So we're going to do that until all of our fingers go away. According to Fidelity Charitable, the 5 most things that you need to have a successful organization or business are clear and compelling mission, strong leadership and governance, effective communication, financial stability, as well as a commitment to impact measurement and learning. So that's a mouthful. Let's do it again. Put a finger down if your organization has a clear and compelling mission. Yeah, see some people putting their fingers down. That's a good thing. Your organization has a clear and compelling mission. Put a finger down. All right, next one. Put a finger down if your organization has strong leadership and governance. Yes? No? Maybe? So? Okay, mine does, so I'm going to put another finger down. Third one. Put a finger down if your organization has effective communication, whether it's top down, bottom up, interactive communication. Effective communication would be another finger down. Put a finger down if your organization has financial stability. This is a tough one, right? Are we putting up? Are we putting down? You're stable, right? Could always use more funds, but if we're stable financially, we'll put a finger down. And then finally, put a finger down if your organization has commitment to impact, measurement, and learning in whatever we're doing, whether it's building programs or fundraising, right? So impact to measurement and learning. We have that commitment in our organization. And so I see many of us still have some fingers floating around, and some of us have a full finger, all fingers down. And so if you've put all of your fingers down, congratulations, right? You should be running the most successful programs in the most successful organization and bringing in all the dollars. Yes? Right. No, of course not, right? Because there's so much more that goes into running successful organizations, communities, businesses, programs, right? And when we talk about community health, there's so many more components than to just these top 5 things that Fidelity Charitable tells us creates success in relationships in business and nonprofits. So just a little spark of the thought to get us all thinking about what some of those things might be. So before we get into it, I figure we should introduce ourselves, tell you who we are and what we do. So as Katie mentioned, I'm Jenna Sistad, and I work for an organization called Neighborhood Connections to Health. You see our team pictured here right on the screen. So Carly is on the left, Carly Trill, I believe she's here with us, manager of program development. She's a full-time staffer. And then on the other side of me, all the way to the right, is Karen Ubeda, our bilingual community health worker. And I'm stuck in the middle as a part-time employee. So really our organization flourishes with the 2 full-time staffers on the outside and me, this tiny little on the inside, maybe part-time, whatever. 2.5 staffers, and we are strong and mighty. And then our mission is to build community partnerships to connect all greater Freehold residents to healthy living. So where do we do all of our work? We are on the western part of Monmouth County in Freehold, for those who don't know us. We have a lot of great resources in our community, but for those who know Monmouth County well, will know that most of the money, resources, programming ends up on the eastern part of the county. And the western part where we are kind of always striving to say, what else can we get? What more can we bring? How else can we help the community? And so this is where Neighborhood Connections to Health comes in. The chart that you see, the bubble chart on the right, talks about all of our subcommittee work. So access to health, we have lead poisoning prevention, we have access to healthy food, we have intergenerational programming, we have community safety programs, biking and walking programs, and we do lots of different things under those 5 umbrellas that I'll talk about throughout the course of our presentation. But how did we determine that these were the needs, that these were the things we were going to talk, center our work around when we were starting out? All right, so what we did was back in 2016 at the inception of our organization was we wanted to create trust in the community. And this is like the most valuable thing. If you get nothing else out of this presentation, remember this: create trust in the community that you wish to serve, with leaders, with residents, with partners. Take away the barriers that cause people to not get involved and not speak up. Create a very respectful, equitable, inclusive platform, and open up the opportunity to people that want to be involved. And then here, Katie, I think you'll probably remember me saying this the last presentation that we did together. Then once you ask them for their opinions and once you bring them in to create that trust, ask them what they think and then listen. That's the part I think we always forget, right? Because we think we know what the communities need. We think our ideas are the best, right? Because we came up with them. However, we are not the ones that have the lived experience that we need in order to know what things we should be working on. So create trust in the community, and please, please, please assess the needs of your community by asking the opinions of those with lived experience. So what did we do? We held focus groups in English and in Spanish. We handpicked some of the people who have been trusted partners and volunteers with us in our early work, and we asked them to help us create focus groups, help us to create the scripts for the focus groups and the questions that we'd ask, help us to actually implement them and promote them in the community. Getting people involved at a level that they feel comfortable was key to our success early on. And so we still use some of those core models from back then all the way until our work now. So we had about 10 focus group with the food insecure, parents of young children, people that only spoke Spanish, people that were homeless, right? And we asked all these different groups, what are your needs? What are the things that you need in this community? And what are your barriers to receiving those things? And we did our focus groups, and then we listened. And that's how we came across those 5 topics and subcommittees that we chose to work on: access to health, access to healthy food, intergenerational programming, lead poisoning prevention, and community safety. And we were strategic about how we did that, right? We didn't just go up the street and ask any, Tom, Dick, and Harry what they would think about this work, because some of them are not keyed into community health, right? They don't have those similar mindsets. So we were intentional about our partnerships. For us, it made most sense to reach out to the local hospital, the local healthcare entities like the health department and the Visiting Nurse Association and the local federally qualified health center. It was helpful for us to have a connection with the schools. It was helpful for us to have a relationship with local government. because we need the buy-in of those leaders. We need the buy-in of those decision makers. And then in order to reach all the people that I've listed out on the left-hand side here, everybody has a little part to play, right? And everybody has a responsibility. And when we work together with shared goals and missions, we can make bigger impacts. So be intentional and strategic about your partners. And that's what we did early on as well.
And Jenna, if I could just jump in, actually, I became aware of Neighborhood Connections to Health when I was still serving on the local school board. And we partnered, the school district, our superintendent at the time partnered with Neighborhood Connections to Health to lead test all of our children because our housing stock is extremely old. And it was a successful program. And we thought we would have a lot more kids, but the ones that we were able to identify, we were able to get them the access to the medical care they needed. And it was just an extremely successful program. So for me, my logical thing was becoming a council person. What more can we do with Neighborhood Connections to Health?
Wonderful. And yes, Annette is one of our biggest advocates. And it's wonderful to have the buy-in of a councilwoman, right? First councilwoman in Freehold. That's wonderful. So back to the effective strategies that I promised we'd talk about in the beginning, how to get more people involved, include residents in decision-making, supporting volunteers, and building lasting partnerships. Let's talk about some examples that in our everyday practices that we've gained experience in and are willing to share. So the first bullet was engage more people. And you do that surrounding yourselves around common goals and outcomes. So for example, the pictures that you see here are all around our Access to Health for People with Disabilities initiative. We got some grant funding from the Division of Disability Services, and our charge was, how can we make this federally qualified health center, brand new in 2019, federally qualified health center, how can we make this more inclusive for people with disabilities? How can we bring the disability justice component to this space? So what did we do? Well, we assembled a community-led group. They named themselves eventually, after meeting months and months on end, they named themselves Health Cares. So the Health Cares group, all voluntary, all community-led people deciding what things would be needed to make this impact at the health center for people with disabilities. And so what do? We got Health Cares together. We toured the center. We literally walked through the center and had somebody talking about all that they do there. And the Health Cares team were people comprised of people with disabilities, their caregivers, and their service providers, and anybody who has a disability mindset, right? And as we were walking through the health centers, we had all these people looking at it from different perspectives to say, okay, this improvement can be made here, or we need a ramp out front. We need multiple handicap parking spaces out front. There was very limited handicap parking spaces. And so these are just a few of the activities that we did together with this group. We don't have time to go through all of them together today, but my point was everybody had a common goal, which was how to improve access to healthcare for people with disabilities. And we work towards that common goal together to create this long-term impact together. You see some of our members on the right side there, and these are still people that we still talk to today and interact with and are part of our everyday workings. So it's beautiful. And these are people that we didn't necessarily know before we started this, right? Just connection upon connection. The next thing is to include the residents. I've mentioned this before, and I think a good example is our Freehold Intergenerational Community Council here. What this group is it's a group of people, again, all voluntary, no paid personnel that comes together, and on a monthly basis, they meet and they decide what community improvement projects are they going to take on. These are folks that age from 11, 12-ish, all the way up through their 70s, and all ages in between, and all skill levels, and all cultures and backgrounds as well. So we run these groups bilingually. Every month, people come together. In our early days, we did a year-long training, leadership training, so we could assess what skills that we had versus what skills we needed to bring to the table. And this is how we were, again, to determine what projects in the community did we want to take on that were community improvement projects. So I'll give you an example. Right now, this group has decided they want to combat social isolation and bring people together cohesively through a pen pal program. So we're going to engage the local schools as well as the senior housing facility, and we're going to create a pen pal program. This was all, again, through shared decision making, coming up with goals together, priorities together, and sharing our vision. This took a lot of mutual respect. We have to continue to clearly communicate and hold each other accountable. And please don't think that everything that our organization does is just flawless and everything's beautiful and buttoned up. No, it does not come without challenge, right? There are lots of different things that sometimes bring barriers to the work that we do. But I say, if you can find a workaround, find a workaround. If you have resource limitations, try to do it for free anyway. Find those partners that can get you a host location. Find those partners that will, donate notebooks and pens and pencils for this program. Ask a local partner if they'd be willing to commit some time to you to overcome the challenges that you might have. And of course, all of us here today have challenges that we need to overcome. So how can we do it transparently together without unreasonable expectations, right?
I'm going to just jump in right there. And a great example of this is actually a partnership. In Freehold Borough, we do something called participatory budgeting, in which the mayor and council put aside $200,000, and we ask our community what they would like to see funded. And we were struggling actually with getting our word out. So we actually partnered with the Intergenerational Community Council, and they embraced the program and they helped us to get that word out saying, as a community, we have a voice. And I think that's huge when it comes to a healthy community that everyone participates. So last year, they were instrumental in getting people to the polls to vote on, putting in project ideas, promoting them, and then getting people out to the polls to vote. So again, it's just another collaboration with the government and Neighborhood Connections to Health and their subcommittees that's making Freehold a little bit more healthy for the most part. Yeah.
Thank you, Annette. Yes, the Mayor's Wellness Campaign and the participatory budgeting opportunities are limitless for our community. So we really needed to get that word out. And yes, thank you for mentioning that. I didn't put that on the slide. Thank you.
That's okay.
Okay, let's see. What do we have? Okay, the next bullet was how to support small volunteer teams or networks, right? So I should mention that throughout our years of community work, we have gained over 100 volunteers. Do we use those 100 volunteers every week? Maybe not, but we know their skill sets because we've assessed them over the years together. We know who to call upon when we're needing something done at the community garden, or we know who to call upon if we need a bilingual volunteer to help us run a meeting, right? We have all these people in our network, and we try to make the relationship between us mutually beneficial, right? I'll give you an example. Kim is overseeing one of our community kitchen projects. Now she's a registered dietitian and she had to do some type of practicum for school to get all of her hours completed, and she needed to engage with a community project. Well, she knew that Neighborhood Connections to Health had a cooking program and she wanted to use her hours to help make our program more successful and help us lead that. So there was no dollar amount involved, but it was a mutually beneficial relationship because she needed hours, we had them to give. And so it was a nice back and forth. But you always, when you're working with your volunteers, want to create that welcoming environment where everyone feels like they have a seat at the table. Again, removing barriers. So for some of our Spanish speaking volunteers, we don't let the language come between us. We use translation devices, or we make sure that we have all of our materials in both languages so that everyone feels comfortable. All right, here's where I talk a little bit more about our partnership with the Borough of Freehold. And this is where the Mayor's Wellness Campaign initiatives and this partnership and this back and forth is so vital. We're doing things together in the community, and I feel because of the partnership, we're able to reach more, right? So what you see on the screen here are just some examples of the things we've done together. More recently, we've been called upon to do needs assessments, again, because of that trust we built with partners in the community and residents. So we are working on our Safe Routes to School initiative right now, looking for feedback from the community on which sidewalks and walkways and roadways and street signs need work and improvements. That's what we're looking to gain from our community. So working together with Mayor's Wellness Campaign to do that. The Borough of Freehold also helps us to promote and implement our walkability, bikeability initiatives in other ways, right? So you see the corner on the bottom left, this is our weekly bike rides in the summer. Again, this was all a volunteer-led initiative where folks got together and just biked for health in summer months together. It was really a beautiful thing. And then on the top left, you see the Court Street School, which is where we recently did a community needs assessment by touring the building and bringing folks in and asking them what improvements can be seen here to this primarily African-American staple in our community. And we're wanting to uphold the richness and the historical pieces of this charm of this building while making it safer and more healthy for folks in the community to use it in a different way. So again, engaging folks, engaging the community, building that trust, being intentional about our partnerships, and using the relationship that we have with the Borough of Freehold and the government to reach more people together.
And we were able to capitalize on the trust that Neighborhood Connections to Health built in the community. I mean, if we, and you know, I'm sure there's a lot of elected officials on here. If you're going to put out, go, hey, we want to, you know, we want a community survey. A lot of time you're not going to get that kind of response. But an organization like Neighborhood Connections to Health that has that trust within the community, it's so much more successful to be able to partner with them and allow them to take the lead.
Thanks, Annette. Okay, so the next bullet was building partnerships that last. And I think we really have to do that through shared vision. So what you see on the screen now is our Freehold Intergenerational Community Kitchen Group. This was two Neighborhood Connections to Health subcommittee coming together, the one that focused on intergenerational programs and access to healthy food groups. They had similar ideas wanting to do more in the community together, but they couldn't quite figure out what it was. So they partnered up together and they decided that this evidence-based model of an intergenerational community kitchen would be great. And so what does this mean? This is not just a food platform where we distribute food to the community. We do that too, but this is unique where it gives people of all ages and backgrounds and abilities the opportunity to come together for not only a cooking experience, but a social experience, for a cultural experience. We want to make sure people feel like they get to know people they maybe would never meet out in the community without coming together through this experience. And we cook together monthly and we plan together monthly. And the people that participate in this program are the people that are in the driver's seat. These are the people that are making the decisions about when is the program going to run? How often do we want to have this program? What activities are we going to bring to the table? What recipes are we cooking? And it's really that shared accountability, that flexibility, and that transparency in decision-making that helps make it flourish. And of course, we wanted to have more of that long-term impactful solution when it came to food access and social connections. So that's what this group does. Again, all volunteers. And then how do we keep the good things that we have going? How do we make sure they sustain? Well, we continuously reevaluate what we're doing. Are we doing it right? Are we doing it well? Do we need to be doing it differently? And so that's where our Freehold Tenant Association comes into play. Again, this is a volunteer-led group comprised of stakeholders, organizational leaders, local government, residents. Everybody comes together and talks about the housing issues that we're seeing in Freehold, right? Annette already mentioned that some of our housing stock is older. We have lead-based paint in our water pipes and the paint that we're using for our homes. And that has a lot of long-term lasting health impacts for the families that live there. So how can we together as a community unit work on some of these housing issues that we are challenged with. And the way that the tenant association is doing that is through Upstream's approach with their homelessness prevention campaign. So you might not have to do a formal PDSA cycle, plan, do, study, act, but you often do have to reevaluate what you're doing to make sure it continues to make sense. We have had major political climate shifts. Is what we were doing then still going to work now? We don't know. So we have to continue to ask folks. And how do we do that? Through surveys, through personal interviews, through focus groups. It doesn't always have to be this large, community needs assessment type of thing. It could literally just be having conversations with people who use services in the community and asking for their feedback. And then, of course, listen. When they tell us, listen, remember, and actually try to work on those issues. And here are just some of the key takeaways. I know I talked about lots of different programs and gave examples of some of the things that we're working on, but I always just wanted to remind folk that equitable respect equals that trust building that we keep talking about, right? So offering things in multiple languages, removing barriers, meeting people where they are, all of those things help to show people in the community that you're trustworthy. Use your volunteer networks for the variety of skills that they have to offer. There's those silent leaders sometimes that are really good at note taking, but then there's those more present vocal leaders that are okay to lead meetings or do a presentation. Use those volunteers for the amazing skills that they have, and make sure that it's mutually beneficial to both parties. Remember that there will be challenges. Always there'll be a challenge, right? But you have to be transparent with your teams enough, your boards, your staff, your partners, the community. You have to be transparent with them. And truly, they have wonderful solutions to some of the challenges that we come into. So we want to use that shared responsibility concept again, even when challenges arise. And please, please, please be adaptable, right? Funding can get pulled from under our feet in 2 seconds. So continue to assess your community for the things that they offer, right? Use free spaces or use partners that can bring different things to the table so you don't necessarily always have to pay for them. And be willing to be flexible and adapt when things change, because you can't stay stuck in, well, we used to do it like that 5 years ago. That's just not gonna work these days. And then finally, make sure your goals are aligned so that your partnerships not only are intentional, but they're impactful. Think about what you want to accomplish in 3 or 5 years and make sure the partners that you're engaging have those same mindsets. And that will really eliminate a lot of challenges and confusion during the extension of the partnership. So when you think about your 5-finger activity, again, remember that yes, successful qualities could be, good communication and strong leadership and financial stability, but there are many, many more things that come into relationship building with your community and making it thrive from a community health standpoint. So I hope that you can remember that as we move into the next part of this workshop. And this is me. And I just wanted to thank you and make you aware that we are on Facebook, we do have a YouTube, we are on Instagram, but I would say our Facebook is probably our most, where we see our most foot traffic. So if you can whip out your phone right now, put it to the screen, use the QR code to like us on Facebook, share what we're doing, follow our work that way. And our website is there too. If you have other things you want to look at there, just let us know. And thank you. Thank you for this opportunity. I'm here to answer any questions you might have.
Great. No, thank you so much, Jenna, and thank you, Annette, for this wonderful presentation. I do see that we have one question already in the chat, and it says, what are some best practices for cultivating a strong volunteer network?
So when you're thinking of creating a strong volunteer network, you want to be intentional and you want to be transparent. So, I'm thinking of some of I'm thinking of Jean Patterson. She's our master gardener. She oversees initiatives at the at the community garden, I would never ask Jean to do a lead poisoning prevention workshop with us, right? Because I know her skill set is more so food-based focused. So knowing what your volunteers' skill sets are immensely helpful. We have a one-pager that we ask people to fill out. You could fill it out via paper if you want to, or we have it electronically where we ask you all about the times that you're available to volunteer. What are your interests? What are your skills? So really taking an interest. It's just like anything else. You're sending your kid off to school. You want to get to know that teacher, don't you? It's the same thing. You're having a volunteer come to your organization and promote the things you're doing and work with us to make the community better. You want to make sure you kind of know that person and what their skill sets and their strengths are and their challenge areas too. So I would just say really that making that connection and knowing them, and then making it mutually beneficial so they get something out of it too. And also incentivize them when you can. Sometimes we come into grant dollars where they allow us to build incentives into the budget. You know, gift cards are always nice and things of that nature too. And I don't know, Annette, if you had anything more that you wanted to share there.
No, I think you kind of touched upon it all. Maybe what you can do is share that form that we have for the volunteers, and then
Yeah,
people can take a look at that.
yeah, I think Carly's here. Carly, if you're here, can you share that that volunteer sign up form, please?
Yes.
Yay. Thank you.
Yeah.
Thank you. And while we're still fielding some more questions, we had asked a question on like what are areas that you need support on during registration in your community. And so one of the challenges that a lot of towns had shared with us is low attendance, even if they advertise the event very well. Do you have any approaches that you have seen that really help get people to show up and then keep coming back?
Yeah, the first one that we all know of, right, is food. If you feed them, they will come. And I know that's tough too, because we don't always have a budget. But again, asking that those partners that maybe have a budget that you don't have for refreshments or something like that, incentives. We just ran into this issue the other day. It was one of those like 100-degree days. We held an event, which we typically have like 40 or so people that attend, right? We offered it in person and in Zoom. We offered incentives, raffles, we offered food, and we still had low attendance. So it happens sometimes, right? You're not gonna hit it 100% of the time. So be gentle to yourselves. But yeah, you wanna survey the community. We actually are intentional about that too. We have a very active WhatsApp app group with a lot of the residents, and Karen, who I believe is here, our community health worker, she's constantly talking with them in there, asking them, what time of day is good for you? What days of the week is good for you? If you were going to learn about lead poisoning, what exactly would you want to know? So really seeking the feedback from the people that will participate on when they're available is mostly helpful for us. But of course, weather, time of day, school schedules, all that impacts it too.
Great. Thank you,
And don't
Jenna.
be discouraged. I mean, it's a building process. I mean, our very first veggies and vaccines, I mean, it was light in attendance, but as we grew, every September we do an event. We partner the Mayor's Wellness with Neighborhood Connections to Health and some of our other partners in the community, our health-based partnership. And as the years have gone on, it's just grown and grown and grown. And we'll free vaccinations, and then on top of it, you're getting vegetables, and people actually look forward to coming out to that now.
Mhm. Great. Yeah. Thank you both, Jenna and Annette. And I just want to call out that title, Veggies and Vaccines, right? I think that is a strong way to get your events to have people to come out, because if you just say vaccine clinic, people might be like, do I really want to go to the vaccine clinic? While something like Veggies and Vaccines is more playful, it's more community based. There's something else there other than a vaccine. And sometimes it's the veggie that gets the people out for the vaccine, or the vaccine that gets them out for the veggies. So thanks for sharing that great title.
Oh, and we can't I don't know if we can take credit for the title. Kim Simers of Central State came up with the title. Edgar, tell her that Edgar's here from Central State. Tell her that we shouted her out today.
That's
Will
great.
do.
Yeah. And that's great, because like that was like you were talking about, like working with your volunteers and the people that support you and like their skill sets, right? So she's got this great skill set with coming up with really creative titles. So that's just like another way that you can work with your volunteers.
Yeah, over invite, I'd say. Over invite. Some people might be annoyed by it because you're constantly being invited, but there are other people that want to be invited and they want to come. So just over invite.
Yeah, great. And Carly said in the chat, another thing that can help with attendance is if you're able to have a volunteer or a designated staff person to offer childcare during the meeting or the event. And maybe that's also partnering with a local childcare provider, right? So that's a really great call out. I used to work for Family Success Center, and that was the thing that helped us get people out was we always had like a childcare component for our parent activities. So yeah. Um, Another thing, they they mentioned that a lot of residents don't always seem aware of their programs, right? So do you have any strategies that can help bridge that gap and make sure that you reach them, make sure that information reaches them? And I know you talked about a few of them during the presentation, but in case there was something you wanted to highlight.
Yeah, I would say our board is super, super active, very strong board. I mean, our board members will do everything. They will grant write. They will go to a community event and man a table. They will find things that we need, funds, donations, etc. So use the people that are in your network, and if they're not in your network, ask them, your board, your connections, who you're looking to reach. And that I feel is a very good way of being intentional and strategic about deciding your partnerships. I don't know, Annette, if you have anything else that, and I see, thank you, Annette's here, of course, but also I see Jorge Torres is here as well. He's from Brookdale. So like, anything higher education, we know we could call on him. We have Asia she's superintendent of schools. So we know we could get information out to families that way. It's really about, it's not what you know, it's who you know, right?
It's all about the partnerships. I can't stress that enough. Not one of us in this coalition can do it alone, and we just play upon each other's strengths. So the borough might have a grant writer that we can actually go to Neighborhood Connections South and say, hey, I think this fits our mission. We'll have you guys, can you guys help us, with this and administer the grant? If we get the grant, can you guys help us do that? It's all about the relationships. And I always go back to a survey that Neighborhood Connections Health did. It was a couple focus groups we did. We were doing our disabilities grant, and we asked people to define what a healthy community, what a healthy community look like. And they said, they didn't say, oh, neighbor, walks and this. They said a safe, affordable place to raise my family. And that's wellness in a nutshell right there. So I always keep that in mind when we look for programs, and does that fit the overall needs of our community? And again, I can't stress enough the partnerships that you can build within your community. And I bet you, to the people that are elected officials right now, I think you're probably thinking on your hands right now, oh, we got this organization, we have this one. I never thought about doing it with this one. Start with your local food pantry. What can you do? How can you make an impact within the community there? And then just move on. Just keep building on that.
Find the people that are willing to do the work with you. Don't
Yeah.
waste your time on some of the people who don't seem like they're motivated. There's always ways to motivate people, but there will be somebody that's willing to do it with you. You just have to find that person.
Yep.
Great, thank you. And you inspired me to ask a way for the participants to participate, which is just drop in the chat, like Annette said, somebody that comes to mind, right? Whether that's like your food pantry or a specific organization, because that will also help everybody else kind of think of different partners that they might not have thought of, right? So it could be your local Rite Aid, or it could be that really strong council person that's going to help advocate with you. So if you all feel comfortable, feel free to just drop that one person, place, or thing. And then the other thing is I know we're saying board, but you can use that interchangeably with your mayor's wellness campaign committee, right? And so I just wanted to kind of throw that out there. A lot of what Jenna and Annette are saying about the board or the people that are helping you like pull together all your programs, you can think about that as like also your committees. Great. And okay, there was one more thing that kind of popped up. Um, I think I know we have talked about this, but another thing that folks had asked about um, what is or sorry, how can communities successfully connect with harder to reach audiences? Often they find that it's easy to reach seniors or relatively easy to reach seniors, but everybody else below that or around that they have a harder time with. So do you have any great suggestions or strategies that you've used?
I'm not sure I understand the question. Can you say it in
Oh,
a different way, Katie?
yeah, no worries. Just how have you reached harder to reach audiences for your program? So, whether that's parents, people of color, or uninsured. Yeah,
So when you said seniors, I was wondering, do you mean senior citizens or senior in high school?
good
Uh,
question.
so
Both.
harder to reach populations. That comes up a lot because I want to say 80% of our town is reduced or free lunches. Is that right, Annette? Therefore, those same people
Yes.
are probably our low or uninsured folks, right? We have a large population of non-English speakers, and we have a large population of undocumented residents as well. And we reach them all independently of each other as well as together. I think that was why it was so important for us to pull our intergenerational group and start doing work there so we can reach more people and not discriminate via age or status in the community. So reaching them, give them the opportunity, provide them with the opportunity. You're not going to get somebody that's a Spanish speaker that's going to take part in a survey or a community group or a meeting or anything, even if it's the best meeting ever, if they can't read the flyer because it's not in their language. So these are just very simple mindset changes that the communities have to make to be more effective, to reach people that may not have the opportunity otherwise. They want to get involved. I feel like they want to, they just don't know how to, and they don't know where to turn.
And there's so many different, like, I'm just sitting here thinking, our police department had done a program. Can't remember what it was about. It was something about safety in the community. And they held it at Borough Hall. The attendance was so poor. But when they moved it out of there and they went to one of our partners in the community, Casa Freehold,
Mhm,
attendance was huge because it's just little things like that. The venue that you hold it at can make a
mhm.
huge difference. People are intimidated to go into a borough hall, but Casa Freehold is one of their community safe places. So they did it there and it was much more successful. Just simple little things like that.
I
Yeah.
know you think we have to make these big transformational changes, but it can be something so little
Yeah.
Yeah,
that we may take for granted.
great. Okay, so unless anybody has any other questions, I'm just gonna kind of talk about what's coming up next for Mayor's Wellness Campaign. If you all are thinking about a question and you still want to ask it, please do put it in the chat or feel free to unmute. But I'm just gonna do a quick little this guy. Okay. So, just before we wrap up, I just wanted to share some information about other ways to stay connected with us in the coming months. Make sure you are signing your pledge. You can do that today or when you see us all down at the New Jersey League of Municipalities in November. We also have a COIL partner meeting coming up on November 6th, and we're going to be planning COIL events. So if you're looking to bring one to your community, this is a great opportunity to get connected to the folks that have that expertise. Feel free to visit our booth and our panel at NJLM in November, and then you can save the date for the Healthy Town Technical Assistance webinar on December 2nd. it amazes me that we're already thinking about that. I just thought I was doing the Healthy Town webinar. So, and then also visit our website where you can find evidence-based tools, our handbook, and stay up to date on our upcoming programming. And then just thank you to all of our sponsors, funders, and partners. They make the Mayor's Wellness Campaign happen. So, and let's see. And then that's a thank you. But I also just want to say thank you so much to both Jenna and Annette for their wonderful presentation and insight. And I do hope that this was really helpful for everyone here. And last, I want to say when you do exit, a survey is going to pop up for you. So if you could do that survey, just like we're talking about here, right? Getting feedback from your community, getting feedback, you're our community. So that will help us design better programs and opportunities to work with you all. And yeah, thank you again.
Thank you. Bye-bye, guys.
Thanks, Katie. Thanks, everybody. Take care.